Hi, I'm going to talk today about the team in primary care, the team that is the doctor and the people working with her or him. We talked before about why it was important to have a behavioral health or a mental health clinician in the office. But today I want to talk a little bit more about how the team works together and about how the team is evolving, because the team in the average primary care practice 10 years ago, even certainly 20 years ago, is not the same group that is likely to be in the primary care practice now or in the short-term future. So let's start with the idea of the practice as a group of people supporting a doctor. That's certainly how primary care used to be, and still in many places is still. So you have this doctor, and I can add that sometimes the person that I'm calling doctor is actually trained as a nurse practitioner, an advanced nurse trained to do primary care, or even a physician's assistant. They usually are not just practicing in offices by themselves. They're in an office with a doctor, but they have pretty much the same role as far as the patient is concerned. And patients tend to call them doctor. They say, "Who's my doctor?" They'll name that person. So I just call it, since that's what the patients say about the person, I just say doctor for everybody. So the doctor is the person who is seeing everybody. That's who they came to see. And somebody has to help with all the other aspects of what's going on. So you have administrative staff, of course. Somebody has to check you in, and they check your insurance, and they check your information ad nauseum. Sometimes you still live at so-and-so, you still have such and such a phone number, blah, blah, blah. Then you wait for a while. Then someone comes to get you and put you in a room. They actually, in primary care, they call that rooming somebody. And they take you back to an exam room, and they do what are called vitals. So they weigh you. They take your blood pressure and your pulse, sometimes some other things, but mostly those are the things that they do, and they confirm information about you. Sometimes they'll ask you some questions about your health or about what you came about today. They're all basically preparing so that when the doctor comes in, she is the most organized and ready to work that she can be, because her time is the most important resource. And so it's the most expensive resource. The doctor's getting paid more than anybody else in the office, but they're also, it's the time, it's the resource that you only have a certain amount of. And so how many patients can be seen and how well the practice can run really depends on the doctor being able to move smoothly through the day. So this person who takes you back is sometimes trained as a nurse. More likely nowadays, they're trained as a medical assistant. Medical assistants have, they can have an associate's degree or possibly a bachelor's degree and medical assistance training, but it is less training than a nurse, and so people who are medical assistants are paid less than registered nurses. In the average primary care practice, there will be a few, a registered nurse or two, but they often are on the telephone. They're answering when patients call in because they're more qualified to answer simple medical questions and to make a determination of whether someone who calls with a problem needs to come in right away or needs to go to the emergency room or can wait to be seen. So the doctor then sees you, does their visit, and then sometimes the medical assistant has some other things to do to confirm something or to take you to the desk to check out or to make sure that you get the prescription that the doctor wrote, those kinds of things. And then you check out and go home. This works pretty well. It works pretty well when patients are pretty educated, pretty good at knowing how to how to go to the doctor and what's expected of them, who can handle things in terms of getting their own medication or who understand the information that's given to them by the doctor. When all that is in place, this system works fine. A couple of things, though, can really stress the system. One is when the patient isn't able to do all of that, when they have issues in terms of understanding what they're being told, or understanding how to be a patient, understanding how the system works. Then there needs to be somebody to help them through the system, and or to when they get a referral to a specialist or to some other service to help them get there, help them get their appointment, see that they know how to get there and what the referral is about. Those kinds of things start to make the stress the practice. When the medical assistant or the nurses or the doctor have to also do those kinds of things, then people start to get overworked, start to get stressed. The other difficulty is that the number of things that doctors are asked to do just goes up and up and up. If you are a public health person in the country, let's say you just discovered that there is a new approach to helping people quit smoking, and that you want to make it available to everybody in the country. How are you going to do that? Well, if you are like many public health movements, what you do is you say, well, everybody goes to primary care. We'll get the primary care doctor to do that. And if there's enough pressure, and if that becomes the standard of care, which is how the term that's used in medicine that basically said the doctor really ought to do that if they're doing a good job, why then now the doc is supposed to do that as well. So they have to check on all kinds of things for each patient just to see if this is a problem they might have, or if it's a service they might need, or if they have some kind of chronic illness. Sometimes there are a great deal more kinds of checks. So if you have diabetes, we have to be sure that your feet get checked and that you get an eye exam, and that you got to go get your blood work because they have to do that more often. And so the amount of keeping up with patients and doing more for each patient has tended to rise over the last 20 years at least. And so doctors get more stressed. And the stress of primary care doctors especially, because primary care doctors, you remember, is where people bring whatever their problems are. If you were a cardiologist, you can be pretty sure that somebody coming to see you has either a heart problem or symptoms that might be a heart problem. But if you're a primary care doctor, you don't know what they got until you have time to try and figure it out. And so since all these problems come to primary care, and since all of these public health efforts to try and do preventive care come to primary care, the stress on primary care doctors has gone up and up. A great example recently has been the opioid crisis. The best way to reach people who are struggling with opioid addiction is through primary care. If you open up a drug center, you'll get a certain number of folks, but if you offer the care in primary care, and there are treatments that we can offer in primary care, you're much more likely to get people, partly because they have a relationship with their doctor, and partly because it's much less stigmatizing to go to the doctor's office than to go to a drug treatment center of some sort. So this is the latest example of a big piece of stress that has been put onto primary care. So it is happening now that primary care doctors have a pretty high burnout rate. And we don't have enough of them anyway. And so when we get an expansion of Medicaid, for instance, and so overnight in some state, 1 million new people will have a right to go get a doctor. There aren't doctors for 1 million new people in the state. And so the pressure gets higher. So what are they going to do? And one of the things that's happened that they're going to do is they're going to need to add to the team. And they're going to need to work as a team, not just as people supporting the doctor. So when the doctor is the person who's the main expert, and the medical assistants or nurses have a little bit, or sometimes a good deal, of that same expertise, but the doctor is the most expert in medical things, there's only one kind of expertise really on the team. When we added a behavioral health clinician, though, now we have a whole new set of expertise, skill set on the team. And the behavioral health clinician can help with some of the problems that were particularly challenging for the doctor. The doctor didn't you couldn't expect a doctor to be able to do interventions for depression other than give medication, or to take the time it would take to deal with helping someone build their motivation to lose weight, or talk about their frustration with trying to raise their kids. All of those take more time. Remember, I said that's the most precious resource. And so adding a behavioral health person begins to make a real team, not just a group of people supporting one leader. As that continues, for patients who have particular needs, like needs to be helped to deal with the healthcare system, or needs for things like housing, or for getting a ride to the health center, or a number of things that often we call the social determinants of health. Basically, that's a concept that if you Google it, you'll discover that there's a good deal of literature on the social determinants of health. And these are things like housing and food and various things that are make a difference not only in the comfort of your life, but in your actual health. So we talked in the earliest, in our first module, about the biopsychosocial approach. And for particularly the patients who have the most difficult, challenging lives, it really ends up needing to be a biopsychosocial team. So you have a doctor, you have a behavioral health clinician, and you have a care manager or case manager or care coordinator or navigator. Different people use different words for that role, but that's the person who is helping people in the community with their difficult challenges in the community, or the person who's helping, who can outreach to folks and who can help them and follow up at their house, or calling them regularly to see, are they able to fill their prescription? Were they able to find the medicine? Can they afford it? All of those, the kinds of things that it takes to support some patients in order for them to be able to actually take advantage of the expertise and care that the doctor can offer. So the team is growing. The medical assistants and nurses are getting augmented by a behavioral health clinician and a care manager in many settings, or in some settings, just one or the other. As the team grows, doctors report that they feel better about their work, that they are happier to come to work, that they feel that they're more effective with their patients. This is all, there's a lot of evidence for this. And one of the things you should know about doctors is they didn't go through all this training and all medical school and all that studying and passing chemistry, which I couldn't do, in order to not get it right. These are folks who want to know the answer and they want to get it right, but they don't necessarily feel like they have to do it. They just feel that they have to see that somebody can do it, and that when patients come to them, they're going to get the help they need. So that is expanding the team. And now we have on healthcare teams, it's not uncommon for a number of different roles. We did a survey from in this workforce project out of Antioch University, New England, Center for Behavioral Health Innovation. And we contacted the health centers all around New Hampshire. And we said, so what roles do you have there on your team? And we found community health workers. We found medical interpreters. We found navigators. That's someone who helps you get around the health system. We found substance abuse counselors, and of course, behavioral health clinicians, and care managers and care coordinators, and sometimes they were called case managers, and patient advocates, and pharmacists. I would have to look up to get the whole list, but you get the point. There's a lot of different roles now in primary care. And when you have a strong medical and a strong behavioral expertise set, those folks, these other roles, tend to get stronger and to provide services on both sides. So the care manager will not only try and help you think about how you can get your medication and how you can take your medication, or try and convince you that you might want to follow through and lose the weight that you talk to the doctor about. So they can do this sort of behavioral, kind of motivational part, but they also need to know to ask you, have your headaches gotten better? Have you had any vision problems? They are the eyes and ears of the medical and the behavioral side of the team, and anything they discover, then the whole team can talk about and see how they should deal with it. So everybody, as the team works together, and what they're doing is they're making more time for these teams to talk. They have what they're called huddles before, like a morning of patients. They'll all get together and they'll take 15 minutes to see who's coming today, who could help in what ways, what do we need? Will we need the equipment to do this kind of procedure? Or, in other words, they get ready and they coordinate. Makes a big difference in patient care, lowers everybody's stress. So they're all working in ways that are both behavioral and medical. And so people are learning. They're growing in their skills. And we, in the Workforce Initiative, are working to try and find ways that people anywhere on the team might, as they grow in their skills, get the training they need to move up to a more responsible or more expert role in the team. And I'll talk about that in the next module. But for now, I guess I want to say, as you think about what you might do, think about primary care and think about the possibility that there are a lot of things that you might do there that are interesting and exciting and different on a day-to-day basis. Things are never the same, and part of a team that you probably hadn't thought about or didn't know about. And we'll come back in the last module and tell you more about it. Okay, thanks very much.